Good afternoon, dear friends and respected ma'am. Today we are going to talk about menopause. Menopause, that magical phase, nature's way of congratulating you that you've entered another level and a better level. So whenever you enter a better level, there is always something very nice, something not very nice. So it is 31st of December, night, evening. You're sitting with your family. The children are wrapped up in their quilts. You're wearing your cap and mufflers and heavy thick jackets, and suddenly you remove your cap and your muffler and your jackets and you open the windows to let the cold wind inside because your thermostat doesn't listen to you anymore. Your emotional status, your emotional quotient, it just enters a jet and flies off, and you don't even know what happened to you. Why did you just fly off the handle? And as far as your memory is concerned, well, okay, so now, before I start, I would want to make some things very clear. As per the latest guidelines of the Indian Menopausal Society, holistic approach or the use of alternative therapy is very much certified for use of menopause management. It is no longer considered a quackery. You don't have to hide, write it on another piece of paper, or feel a little awkward that you are using homeopathy or Ayurvedic or naturopathy or Reiki for that matter. These are all considered a part and parcel of menopause management. And you should know about it, because please understand that no matter what, they might say naturopathy and they might use any reflexology, but everything has its plus and minus points. Read about them, know what is good, what is bad, what is to be cautioned, and use it with confidence. So menopause, a natural biological event resulting from the cessation of ovarian functions. We all know there is a decreased production of and ultimately no production of estrogen progesterones and desynchronized secretion of GnRH hormones. The average age of menopause in India is 46, which is earlier than in the Western countries. The last menstrual period is preceded by the perimenopausal phase. So suppose 2020 is the date when she had her periods. A year before that, in fact several years before that, her hormones levels start fluctuating and the first symptoms occur. This is the perimenopause, and it ends 1 year after the last period, when it is very likely that no further cycles will occur. So 2021, January she had a period, 2022 she didn't have, and the entire year, that is when the perimenopause ends. Let's have a look at the menopause map. There is the late reproductive phase, which we all know starts post 35. Then there is the early menopause, perimenopause. This is defined by cycle length varying by 7 or more days. So that irregularity in a woman who's having regular cycles, around 44, 45, she starts saying, or rather earlier, 42, 43, she starts saying, my cycle lengths are varying by 7 or more days. And some symptoms start appearing. Then starts the late perimenopause, when the cycles become all the more irregular. There is a gap or absence of 2 to 3 months in between her regular schedule, and this can last up to 1 to 3 years. Then occurs the final period, that is the menopause, and then the early menopause, which is up to 5 years of her last period. This is the time from the late perimenopause and the early menopause when the symptoms are at its peak. Hot flushes and night sweats are most likely. Then comes the late menopause, which is 5 years after her last period, and this is when the consequences of not caring for herself and not the fault of the gynecologist who hasn't counseled her that ischemic heart disease and osteoporosis and all, they start developing. To make things easy, IMS has adopted the modified Ankylosing consensus group staging, wherein the stages have been divided into 3. Stage 1 is menopause before menopause, which focuses on awareness and risk management. So you have a patient who comes to you in her early 40s, and she starts telling you that her period cycles are irregular, she feels tired or she feels irritable. That is the time when you catch her, get a whole body profile done, ask for a PAP and ask a mammography, her detailed history, and then you make her aware. And that any history in her family regarding breast cancer, VTE, hypertension, catch them then. And that is how you make her life easy. Then comes stage 2A and 2B, that is the perimenopause. This is when the symptoms like menstrual irregularity or vasomotor instability and atrophic symptoms will start. And then stage 3, postmenopause, which is 5 years after the last period. So this is where it has been made very nice. Stage 1, 2 years before the menopause. That is a time when you prevent, when you counsel her, when you get her investigated and you tell her that these things are going to happen. Now you have to be careful about your health. Then the stage 2A and 2B. This is the window of opportunity to treat your patients. Stage 2A is 1 year after the last period. So 2020 she had her period, 2021 she didn't have. So that is the time when it is stage 2A, when most of the atrophic changes, genitourinary, vasomotor, weight gain, osteopenia, everything starts happening now. Then you have stage 2B, this is up to 5 years. So 2020 she had her period, up to 2025 is the stage 2B. This is the intermediate phase. This is a time when psychosomatic symptoms start, the sexual disorders, and all the residual changes from stage 2A like osteopenia or osteoporosis will keep on progressing if you haven't treated her. And stage 3, this is from 5 years post-menopausal till late complications and residual changes from stage 2. So this is the time you can't do much for her except for give her some palliative treatment or reassure her that it's okay, she can still do something about it. Now, is menopause only about hot flushes, night sweats, mood irritability, and sleeping disorders? No. You can look at this picture. There are so many of symptoms which are because of menopause. Let us look at the percentage of discomforts which rank high. Hot flushes occur in the tune of 85%. Vaginal dryness is 28%. Sadness, irritability, lack of sleep is anything from 48 to 60%. Including mood swings. So primarily what we deal with is the vasomotor symptoms and the mood swings, irritability and lack of sleep, and vaginal dryness. So what is the current landscape of management, both hormonal and non-hormonal treatment? What are the options we have for HRT? We have the systemic estrogen therapy, which is given to patients who don't have a uterus. If they have a uterus, we have to give them a combination therapy, and then we have the topical estrogens. So what are the indications for use of HRT as per the IMS guidelines? Please remember there are specific guidelines and please stick to them. So one is vasomotor symptoms, second is genitourinary syndrome of menopause, third is prevention of postmenopausal osteoporosis, that is if you catch them within 5 years of her last menstrual period. And of course prevention of premature ovarian insufficiency. It could be other hormone-related conditions like when you've removed her ovary because of surgery, and those with gender-forming hormonal therapy. And also then, of course, female sexual interest and arousal disorders. What are the benefits? The relief of symptoms like reduction of hot flashes and night sweats. It eases the vaginal dryness, improves mood, it boosts sleeps. Long-term health benefits, prevention of osteoporosis, lower risk of heart disease, may reduce risk of some cancers, maintains the muscle strength. What are the risks? VTE. So unfortunately, because of the WHE studies, which happened long back ago, and they were wrongly published, even then now there is a fear of VTE and breast cancer. But we all know now that for breast cancer, it is, you must know what is the HRT you're using. The ones which are prevalent in the market have a safer progesterone, that is dydrogesterone or the micronized natural progesterone. It was the progesterone part of HRT which was causing breast cancer. So, and you must know for how long you're using it and why are you using it beyond a year, because the risk starts increasing after a year of HRT. If anywhere I go haywire, please President, Menopausal Society, do correct me. And then of course we have coronary heart disease, which of course starts 10 years after menopause. So what are the contraindications? Breast cancer. So again, I did look up breast cancer. If there is a history and it is BRCA positive, in those cases you need to be very careful. Those with coronary heart disease, previous VTE, active liver disease, unexplained vaginal bleeding, you would not like to prescribe her systemic HRT. What are the various non-hormonal drugs? Anyone in the house who's using venlafaxine and escitalopram and paroxetine? Anyone else in the house using them for vasomotor symptoms and mood swings and depression? Yes. Yes. So these can also be prescribed. Venlafaxine comes in extended release form, 37.5 milligram can be given twice a day. Even escitalopram is available as Angicet E, which is quite helpful. And then they haven't mentioned flupentazole, that is also placebo, given after breakfast, which also has a very beneficial role. So these are the drugs which are non-hormonal, which you can use, provided you know them, what are the side effects for both vasomotor symptoms and mood swings and irritability. Tibolon, of course, is a progesterone with selective tissue estrogenic activity. The main role of tibolon is in women. It improves the mood and libido. It is given in the dose of 2.5 milligrams. It suppresses the vasomotor problems, it improves vaginal atrophy, but it does not affect the endometrium. It reduces the proliferation of breast epithelial cells. So that is where it comes its positive effect, because women with large breasts or with fibrodense breasts, where you will be a little hesitant to prescribe her HRT, tibolon can be used. Number two, women who have their intact uterus and they have fibroids. Again here, because tibolon has got does not affect the endometrium, it can be recommended in those patients where MHT, you would like to be a little careful. So like high breast density, myomas, and those where there are mood swings, low sexual appetite is where tibolon can be recommended safely. Now what is the present and future of menopause management? These are the problems: hot flashes, mood shifts, sleep disturbance, libido changes, weight gain, and osteoporosis. What are the present therapies we have? HRT, antidepressants, the various antidepressants, and then we have vaginal estrogen, and then we have DHEA, that is testosterone. Then we have the advanced duct delivery systems of intravaginal systems, hydrogels, zerogels, intranasal and transdermal. And then we have the artificial ovaries. And then of course, like the future of 3D became the 4D, and then we have artificial intelligence. Let's see where we go another 5 years down the line. Let's come to the role of herbal supplements in management of menopausal symptoms. Now, many women, including us, for a variety of reasons concerning the fear of cancer and the adverse effects such as weight gain, we hesitate to prescribe HRT. When we ourselves hesitate, obviously when you are not confident, how can you give confidence to your patient to use HRT? Now, newer concepts are emerging for use of natural products, focusing on preventive medicine and the public perception that natural is good. But please remember, anything natural or artificial has both its plus and minus points. Now in a scene where you are hesitant, the patient is hesitant, and she feels that natural is good, non-hormonal therapies are mostly developing, and women often request a natural approach for their symptoms. And for this, you should be prepared. So this I have taken from the latest IMS guidelines. Complementary and alternative medicines, that is, abbreviation is CAM, is a group of diverse medical and healthcare systems, practices and products that are not presently considered to be part of conventional medicines. But still women choose CAM therapies. Why? Because it mirrors their own values, beliefs, and philosophical orientation towards health and life. Some turn to CAM because of the dissatisfaction of conventional medicine, believe that natural therapies are safe, but it is unrealistic to believe that treatment can provide benefit without the potential for negative effects. So keep this in mind. There will be some negative effect. So know what you are writing, read it, and then go ahead. The impact of the 9 July 2002, the WHI report, like I mentioned, it still has an impact, though it's been so many years, over the concerns of long-term hormonal therapy. But IMS has made our lives so simple. There are specific indications which you use RT, and when you use it beyond a year, reevaluate what you're doing and what is it that you want to achieve. Management of menopause has become a subspecialty, and it requires multidisciplinary approach. Newer non-hormonal therapy options are available. You should be knowing about them. Now, what are these various CAM categories? Alternative whole medical system, Eastern, Ayurvedic, homeopathy, naturopathy. Mind-body practices like hypnosis, relaxation therapy, Tai Chi. Biologically based practices like reflexology, use of substances found in the nature itself. Then there are manipulation and body-based therapies like acupuncture and acupressure. And then there are energy therapies like Reiki. So all of them have been used in different ways for the management of menopausal symptoms. You should be confident of what you are doing so that you can convey your confidence to your patient. So let's start with the biological-based therapy, use of soya isoflavones. It is a dietary supplement isolated from soya beans. It contains phytoestrogen isoflavones. This also modulates the estrogen metabolism. So it has an effect on the bones, decreases bone loss, reduces hot flushes, elevates the antioxidant activity. So improved menopausal symptoms and human health status. So this study was carried out, and where the to compare the efficacy of dietary soy supplementation with estrogen therapy and placebo on menopausal symptoms over a period of 16 weeks. What was the primary outcome? Frequency and severity of hot flushes measured using a daily diary and the menopausal rating scale. They found no statistically significant difference between the groups with respect to the overall MRS score or to scores obtained in the psychological symptom subscale, meaning that whether you use HRT or you use isoflavones, the result is the same. Conclusion. Dietary soy supplementation may constitute an effective alternative therapy for somatic and urogenital symptoms of the menopause. So this is again another study where they were used for hot flushes. They found that the frequency was hot flushes and night sweats. It was found that there was no significant changes in both the groups when they compared the lipoprotein lipids, endometrial thickness, breast and endometrial biopsies. They found the effect to be the same. So you have an alternative to use soy isoflavones when the patient complains of hot flushes and night sweats. They are well tolerated with no significant side effects. Then we have the second product, it is chestberry. It is also known as a phytoestrogenic herb. It stimulates dopamine receptors, stimulates secretion of beta endorphins. We know that beta endorphins are the happy chemicals, increase in the opiate activity, reduces prolactin level by negative feedback mechanism. So supports the vascular nitric oxide activity, endothelial function, and prevents risk of atherosclerosis, reduces the oxidative stress and inflammation. So again, a study was carried out, double-blind clinical trial. 52 women, they were given 8 weeks. For 8 weeks, they were given 30 milligrams of Vitex, 2 arms, Vitex and the placebo. And after 8 weeks, estimation was done. It was found that the score for total menopausal disorder, anxiety, vasomotor symptoms were significantly lower in the Vitex group compared to the placebo group. So conclusion, that administration of Vitis agnus castus extracts as a phytoestrogenic medicine can elevate menopausal symptoms in women. So again another study, and again the result is that there was a decrease in the severity of hot flushes, and it is an effective treatment for early vasomotor symptoms of postmenopausal women. We all know about ashwagandha. It is available at Patanjali as capsules. Have you ever seen the pure form of ashwagandha? It's in a powder form and very expensive. Scientifically known as Withenia somnifera, member of, so let me come. It has numerous physiological actions, anti-inflammatory, neuroprotective, adaptogenic, cognitive, enhancing effects. It plays a potential role in inducing gonadotropin release hormone secretion, and thus, so in my first slide, I did mention that there was desynchronization of release of GnRH hormones, so it improves the hormonal balance. So again, a study was carried out, and there was ashwagandha was given twice daily for a period of 8 weeks, and there were 2 arms, no arms in the study group. And what was the result? There was, because of its role on the GnRH secretion, there was increase in the serum estradiol and significant reduction in serum FSH and serum LH compared to placebo. It is a safe and effective option to relieve mild to moderate climactic symptoms during perimenopause in women. The third product is black cohosh. Commonly used for menopausal symptoms, hot flushes, night sweats, vaginal dryness, heart palpitation, vertigo, sleep disturbance, nervousness, and irritability, all of which are so very frequent during menopause. Again, a study was carried out for 12 weeks versus placebo group at 4 weeks and 12 weeks later. What was the result? It was found that hot flushes, atrophy, and psyche, they all decreased significantly in the group which was taking black cohosh. So this is one study carried out by Indian doctors. Effectiveness of multi-system support for better relief and elevation of common effects in perimenopause, the Embrace Perimenopausal study. And the aim was to evaluate the efficacy and safety of all these products which I have mentioned earlier, Earth Menopause multi-system capsules, providing evidence of nutraceuticals as an alternative to HRT. So all of them, ashwagandha, black cohosh, all of them are nutraceuticals, and they are an alternative to HRT. What was the outcome? Primary outcome included changes in the menopausal symptoms, which included hot flushes and improvement in the breast tenderness. Secondary outcome was the assessment of the quality of life, changes in the hair and skin texture, and patient and physician global assessments and interventional tolerability. So, starting with hot flushes, here we can see that there was resolution of the symptoms at day 60, up to 93% patient improvement. In night sweats, it was again up to 88% improvement. And in the quality of life, again, there was after 30 days of treatment, there was an improvement in the quality of life also. So what is the conclusion of this study carried out by Indian authors? It demonstrates the efficacy and safety of the Earth Perimenopause Multi-System Support Capsules in elevating perimenopausal symptoms. A significant improvement was observed in hot flushes, sweating, anxiety, mood depression, irritability, sleep disturbance, and the results were consistent with statistically significant changes as early as day 15 for several symptoms, highlighting the rapid efficacy of the treatment. Additionally, the intervention was associated with improved quality of life and high level of patient as well as physician satisfaction. Management of a patient with troublesome menopausal symptoms using non-hormonal treatment. I can't read it from. So basically, since I can't read it from this far, so the patient comes to you, you've taken her detailed history, you've done a physical examination, then you have to offer her the various choices, whether she wants a pharmacological therapy or she wants a non-pharmacological therapy. What is the basic complaint she has, whether they are vasomotor or whether they are vaginal or whether they are mood swings. And accordingly, you have to prescribe. So whatever you prescribe, the patient's affirmation and involvement is a must. Thank you for listening. And if at any point in the talk you felt hot, don't worry, it wasn't me, it was your hormones.